Any other material you'll see or hear on Heading in the Right Direction are for informational and educational purposes only. Heading in the Right Direction is not intended to be a substitute for professional help. Dr. Cohen is providing his general opinion on heading in the right direction based on his experience. Dr. Cohen is not your doctor and is not giving you professional advice. Dr. Cohen gives professional advice in private sessions to his patients. If you have a doctor, your doctor should be consulted with any questions you may have about the information you saw on Heading in the Right Direction. If you do not have a doctor, you should seek the services of a doctor and not rely on Heading in the Right Direction. Also, some of the information presented on Heading in the Right Direction is subject to legal protection and may not be used without the permission of Dr. Cohen.
Host of the show Heading in the Right Direction. We'll talk today about a very complicated, severe condition that perhaps many of you have heard of called post-traumatic stress disorder. Before I do, though, on one quick lighter note, in the shows I've done before, kind of funny in a way, my tie has tended to sort of oscillate a little bit like a metronome, as a friend of mine described it. So my dear friend Patty insisted that she get me a tie pin, something I haven't worn probably since 7th grade, if even then. I objected then. So I'm hoping today that my gift from Patty will keep my tie straight. So I just wanted to put that out there, and now to get serious. Post-traumatic stress disorder, or PTSD as it is summarized, that's the acronym. Post-traumatic stress disorder, first I want to describe in general, it is an experience, it is a condition in which the trauma has to be a life and death trauma, something in which life and death was involved. It can also involve someone who witnesses something that is actually of a life and death nature. So an important part of the criteria for that is life and death needs to be involved. And it can be, again, either directly experienced or experienced through observation. The symptoms of PTSD, which I'm about to describe, can last for a very extended period of time, unfortunately, but I will get to the symptoms shortly. So let me first make a distinction between the direct experience of post-traumatic stress disorder and the trauma versus by observation. Several main examples, typical examples that come up for when someone ends up suffering from PTSD. For example, someone in the military who comes home after a terrible experience in war. For example, someone who experiences a natural disaster, hurricanes, earthquakes, so forth. Or it can be somebody who was in a very serious car accident or plane accident. Or just as one more example, it can be someone who was attacked by an animal. It could be a severe dog bite, for example. All of those are personally experienced types of traumas that can trigger PTSD. But PTSD, again, I mentioned a couple of minutes ago, can also occur through observation of something that is this life and death implicating. So it doesn't have to be the person experiencing it directly. It could be observing it of a loved one, especially someone who's very important. It certainly will, especially if it's a child. It can be as much a trauma for the observer as it can be for someone who's directly experienced it. Okay. Again, the process of observing is as traumatic, or at least it can be. All right. So let's talk about the symptoms of PTSD. And the symptoms are symptoms that I will describe, but they must be severe in order for the diagnosis of PTSD to be an accurate diagnosis. So, for example, some of the main symptoms of PTSD, what's called generalized anxiety disorder, abbreviated GAD, pattern of being very nervous, very jittery. It can also be panic attacks, which can occur sometimes several times a day and be extremely distressing and debilitating. There can also be signs, certainly, of clinical depression. And for some people who suffer from PTSD, there can be some very real problems with addiction. So all of those represent the clinical problems. But they're also, as part of PTSD, there can be cognitive problems, there can be behavioral problems, and physical problems. So let me throw a few of those at you. Starting with cognitive problems. Let me list some that I have here in front of me. Again, the password, though, as with clinical symptoms, is severe. So, for example, avoidance, extreme avoidance of anything that reminds the person of the traumatic event. Certainly there can be flashbacks, there can be nightmares. There can be what's called hyperarousal, which is a great deal of agitation that gets generated, manifested in, it could be irritability, overreactivity, having a short fuse. It can also be what's called emotional numbness or disconnection, where there's a sense of not having feelings, really positive or negative, although the negative may be a lot stronger and there may just not be a sense of positive feelings or pleasure. There can be brooding, there can be melancholy moods, there can be impairment in memory and concentration and motivation, loss of self-confidence and self-worth, and last but not least, there can be very irrational guilt, especially for someone who survived, especially let's say war, where you survived, friends, people around you didn't, a sense of what's called survivor guilt. I shouldn't have been the one, why wasn't it someone else, etc. There also, again, though, can be physical symptoms. For example, for some people, there can be a problem with sleep and appetite. There can be big problems, body pains, gastrointestinal symptoms, high blood pressure, and so forth. And what I want to be sure to add immediately is that if these severe clinical, cognitive, behavioral, and physical symptoms of PTSD are not treated, and treated as quickly as possible, they are more likely to fester, they are more likely to perseverate, and last, it can be, if not years even, God forbid, it can even be decades. Okay, next, a couple of statistics I'll throw at you. I want to distinguish between what's called the incidence and the prevalence. So let's start with the incidence. A couple of studies that I reviewed show that the incidence in this country, the population experiencing PTSD, the estimate is between 8 and 12% of the population, which, although may sound like relatively small percentages, compute or add up to approximately 28 to 35 million people, which, as a figure, does not, of course, include people who don't seek help, who aren't diagnosed that way as they perhaps should be. So it is ultimately a pretty sizable percentage of people. As for what's called the prevalence, there's a study I especially want to briefly tell you about. It's a study that showed that victims of something traumatic that happened, if you're in the military, if you're a policeman or fireman, the percentage of developing PTSD is generally in the 15 to 30% range. However, there was a study that I saw that showed that victims of rape, women of course especially, some type of physical assault, even child abuse, percentages of people who develop PTSD as a function of those trauma is actually a good deal higher. It can be 40%, 50%. So it kind of indicates, generalized, more men than women, military, fire, and police, actually that's more likely their trigger for PTSD, but for women it can be the types of assaults on them physically, on them emotionally, that is more likely to trigger PTSD. A couple more things and then we'll take a break. One of the things, I'm going to have a guest later in the show, and I'll also have a guest before him. It's a psychologist who's a colleague of mine and an expert in the treatment of PTSD and anxiety disorder. He's going to talk about predisposing factors, why certain people are more likely to develop PTSD, have had something traumatic than other people. He will address that at length. Last but not least though, two quick postscripts. Number one, very important to keep in mind, there are people who suffer from PTSD who start judging themselves. Oh, there's something wrong with me, I'm weak, man will say I'm not a real man. Very important to get off those judgments and on to two terms that to me are the terms you want to use that are not judgmental. It's human and normal. It is human and normal in the face of a severe trauma to end up with severe symptoms like PTSD. And again, I will repeat, it is essential to get treatment, whatever aspects of treatment are. And again, my guest, Dr. Peter Denigris, will be addressing that. So, we'll leave it at that for a moment. Why don't we take a break? This is Heading in the Right Direction. I'm Dr. Sidney Cohen.
In a world where bankers have lost all interest, where robots and fat cats rule our fortunes, one woman will stand up and strive to do the impossible. Be treated like a person. Friends and neighbors will join her quest. Ordinary people will band together against the forces of corporate greed. And together they will form Philadelphia Federal Credit Union, already in a neighborhood near you.
Imagine the finest hand-selected USDA prime steak you'll ever have. The freshest line-caught seafood, our Wine Spectator award-winning wine list, and soul-satisfying desserts. Bring that together with the perfect date, the winning business deal, a memorable family celebration. Welcome to Rod's Steak and Seafood Grill in nearby Morristown, New Jersey. Bring your appetite and feed your passion.
Your credit score is yours, and at Experian Credit Expert, we want to help you really use it. With access to helpful Experian experts over the phone and online, we can help you use it to get a better idea of what info the banks have on you. Use it to get more choice of mortgages. Use it to make your money go further. Take the next step to improving your financial future with your free 30-day trial at experian.co.uk.
Here at Freppy's Tex-Mex, you can definitely taste the freshness in our food. You should definitely come to Freppy's because it's a great place. You can bring your family, very kid-friendly. All my servers are amazing, friendly people. Everyone here is just happy to serve, and I think it shows. The thing that sets us apart is the quality and freshness of our food. And I think once you try it, you'd be coming back. I'm Joe DeSario, co-owner of Freppy's Tex-Mex in Plainfield, New Jersey.
Hi, I'm Jim Turpin, host of Your Best 50. Please join me every Thursday at 3:30 where we'll cover topics that are important to the baby boom generation and their kids. And let us help you make this your best 50.
We're back. I'm Dr. Sidney Cohen, and again, this is the show Heading in the Right Direction. We're talking today about post-traumatic stress disorder. The next segment of my show is going to involve my having a guest who I am very grateful agreed to appear today. His name is David Nicholas, and I very much appreciate David's willingness to be on the show today. And David is going to describe to us what I can only think of as being characterized as a truly harrowing experience related to PTSD. So, David, I want to thank you again very much for being here today. And I would say, why don't you take the ball and go with it for us, as they say. Tell us about your experience.
Well, as you described, Doctor, it was a very harrowing experience. I was in the World Trade Center on September 11th, 2001, and barely escaped in time to save my life. It was the most terrifying thing I've ever experienced, to say the least. It was a tragic day all around, but to really physically feel that fight or flight response and have flight take over and have to get away was truly, truly terrifying. And I still suffer some effects from that today. Right after it happened, for a number of years, there was always this underlying tenor of just anxiety and irritability and just a physical inability to focus based on that. I was constantly edgy. I was set off by the slightest thing would set me on a rage, on an angry tirade. What other people would consider to be a minor inconvenience would really set me off and set me in a panic. Panic attacks would be frequent. At its worst, I would suffer from 4 to 5 a day of just complete and total panic and fear, and it was paralyzing. It was paralyzing. It made it difficult for me personally and professionally. Personally, it was very off-putting to people who were close to me, friends, family, woman I was in a relationship with at the time. I mean, certainly in the immediate aftermath, I got a lot of compassion, and people were happy I was alive and happy I was fine. But
Sure.
After a while, I think my attitude and my change in emotion started to create some distance between myself and those people, and it made it difficult for me to maintain even basic friendships with folks because I was always so panicked and so agitated. At work, at the time, I was a project manager for one of the companies at the Trade Center, and while I didn't lose my job, I felt like it was a real struggle every day to keep it. I wanted to keep it, and I had to keep it, but as a project manager, you spend a lot of time on problem solving and decision making, which requires a lot of concentration, a lot of critical thinking, and a lot of focus, and that's something where if you're feeling panicked, you just can't do. So it made it very, very difficult for me to maintain a good rhythm at work and maintain a constant productive cycle at work. It became a real struggle every day to, again, I didn't lose my job, but it was a struggle to keep it. And one emotion that I really kind of surprised me and I didn't expect to feel was guilt. I felt terribly, terribly guilty. After I'd panic, it was this feeling of, why did I survive? And people that I'd stood next to 30 seconds prior to everything happening, why didn't they? Why me and not them? It was a very, very difficult feeling to overcome.
And if I may interject on the note of why me, if there are any words that I've heard come up in my work, and I think most of my colleagues, those are the words. Why me? As though something was involved, something out of your control, certainly, something almost cosmic that made you the one who survived when innumerable number of people around you survived. And that's part of what you're saying. Incredibly difficult.
Incredibly, that why me was an undercurrent for everything. Anytime I saw something that would remind me of the event, a low-flying plane, a picture of a tall building on TV, news reports at the worst, it would immediately take me right back to that moment, and the cycle would start all over again. And that why me was an undercurrent for all of it. Why did this happen to me? Why did I survive? Why am I going through this?
Sure. I appreciate all the detail you're providing. Again, I brought up the word harrowing right from the start.
Very much so.
Just as a quick FYI, not really important, but just so the audience has some feel, you were in one of the towers, I'm assuming?
Yes, sir.
Okay.
Yes, sir.
To clarify that. Okay. So, before I ask you one more question, I want to be sure to ask you, again, I want to emphasize, as David has expounded upon here and made very explicit, the symptoms are severe. The symptoms can be persistent. By the way, I think I neglected to mention before, the official diagnosis of PTSD is that the symptoms stay severe for an extended period of time, at minimum for a few months. And as was David's experience, we're talking a period of what can be several years. Absolute worst case scenario is the symptoms can last for decades. Maybe not stay as intense over that period of time, and that'll sort of lead to one of the other questions, as I say, I want to be sure to ask David. So, to ask you, this was a period of approximately, you'd estimate, 3+ maybe 3 or 4 years.
Between 3 and 4 years, it was really bad.
Okay. So, the other thing then I'd ask you to do is let's fast forward to the present. Let's define the present for the moment, maybe as the last year or couple of years.
Okay.
I recognize that you had shared with me you've gotten some treatment certainly and got that pretty early on. Got some treatment, got some medication.
Absolutely.
So you knew you needed help fast, something I was of course mentioning before is really makes a difference. So now let's bring it again to more recently. What's it like now? I'm assuming yes, you've overall made good progress, but does anything still come up?
Absolutely. Absolutely. I mean, I feel, I'm loath to say better, but I'm more in control of my emotions, and I'm more in control of the feelings and that sort of thing. And that took, for the first 3 years, some extensive counseling. I've tried different medications, and that really did help. And I do, like I said, I do feel more in control. But every once in a while, there's still a bad dream. There's still a reminder and a reaction. But through that counseling and through some additional therapy, I am able to take more control of those feelings and those reactions and those emotions.
Thank God.
Absolutely.
And just to piggyback for 1 minute on how a flashback, for example, or a sudden rebuilding quickly, almost into a panic, I'm imagining, for example, there of course are shows of reliving 9/11.
Absolutely.
And I imagine if you ever see one of those shows, boy,
I've got to watch out on cable TV when the movies that are about it and the documentaries that are about it show up. Any historical footage that they show of New York at the time where those two buildings are standing, it's, your mind starts running away from you, and you fall down that rabbit hole, and you just start thinking about it all again. And that's what I really have to maintain control of.
absolutely. So a lot of it is, relatively speaking, gone in the sense of more control, but certainly not forgotten and
Certainly
not totally gone.
Certainly not.
Okay. David, again, I want to thank you very much for being on the show today, describing your experience. I hope the viewers really got a feel or sense for just, again, how harrowing this can be. And thank you again, and I'm very glad to hear, for the most part, as you say, it's more under control, but never totally goes away.
Thank you, Dr. Cohen.
Thank you very much, David. And why don't we take a break, and then I will bring on an expert guest to talk about the treatment of PTSD.
Here, we have an attractive orange and a distinguished apple. The two similar, but opposites. Theory, a wingman is needed. Or perhaps, a wing lemon. A friend to the orange and an acquaintance to the apple, the lemon brings the two opposites together. See, with a little fresh thinking, the universe can be surprisingly smooth.
When we make Beyond Natural dry dog and cat foods, we start with real meat as the first ingredient. We leave out corn, wheat, and soy. And we own where our dry food is made. 100%. Can other brands say all that? For nutrition you can trust and your pet will enjoy. Does your food go beyond? Learn more at purinabeyond.com.
Fitzpatrick's. Deli dine for breakfast and lunch. And at night, gourmet dine for dinner with entrees and specialty sandwiches including certified black Angus cuts of beef and wild-caught seafood, plus catering options for specialty events. Since 1989, Fitzpatrick's, your hometown place with upscale tastes.
Apple Ridge is about freedom. Apple Ridge is about community. Apple Ridge is about home. Apple Ridge, everything you want, more than you expect. Welcome to your new neighborhood. Apple Ridge Senior Living. Enjoy a maintenance-free, affordable luxury lifestyle today. Visit appleridgeseniorliving.com and find out more about the Apple Ridge experience.
Hi, I'm Levon.
And I'm Dev.
And we are the hosts of Worship Unplugged Live.
Worship Unplugged Live is a live showcase that displays singers, musicians, spoken word artists. It's going to be phenomenal.
So stay tuned to Radio Vision Network. We can't wait to have you join us.
See you soon.
Today's show has been sponsored by Farmers Insurance in Voorhees, New Jersey. To protect your assets and the people you love, call Mike Skoranek, your local Farmers Insurance agent, at 856-336-2553.
We are farmers. Bum, ba-dum, bum, 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 bum.
We're back. I'm Dr. Sidney Cohen, and again, this is the show Heading in the Right Direction. Subject today is post-traumatic stress disorder. I just had a guest on, David Nicholas, who's described in detail his experience, his rather traumatic and trying experience with PTSD. I'd like to now introduce my second guest today. My second guest today is a psychologist who is a specialist in treatment of PTSD and anxiety disorder. Because his practice is up in North Jersey, we couldn't arrange to have him come down today, but he will be doing an interview that I will be able to have him on. And let me introduce him first. His name is Dr. Peter Denegris. Again, he's up in Somerdale. Let me list some of his credentials. Dr. Denegris received his PhD in psychology from the Graduate School of Applied and Professional Psychology at Rutgers. He currently holds positions as both clinical practitioner and managing partner at the Somerville Psychology Group up in Somerdale, New Jersey. And again, as I mentioned, he specializes in the treatment of PTSD and anxiety disorders. And I'm very glad, I'm very gracious, very appreciative, and a lot of gratitude that he's agreed to be interviewed on my show today. So, hello, Dr. Denegris.
Good afternoon, Dr. Cohen.
Hi. Again, thank you very much for being on the show today.
Thank you for having me.
Great. You and I had talked, of course, before the show, and we agreed there'd be a couple of specific questions that I believe my viewers would very much welcome you discussing and answering. So, why don't I go right to the first one? If you can tell us, Dr. Denegris, what types of factors could affect a person's desire to seek treatment for PTSD, and that can ultimately affect the outcome of that treatment?
Well, there are several factors. The first could be their prior experiences with therapy, their own individual unique personality traits, any pre-existing conditions or comorbidity, the number of prior traumatic events that the person has experienced. Also their perception of therapy, whether they view it as associated with any type of stigma or as a sign of weakness. Many people believe that they should be able to deal with the event without professional assistance. Mm-hmm. And then at other times, many people are just simply overwhelmed by the new responsibilities and demands that they must now address or attend to, depending upon the nature of the trauma and its after effects.
Thank you for that. I'm going to go right on to the next question then. If you could tell us, Dr. Denegris, what are some interventions that a therapist or counselor can offer someone suffering from PTSD during the course of their treatment?
Well, in a general sense, really the most important thing is that the therapist establish a very sound therapeutic rapport with the person, whereby they can provide comfort, they can provide reassurance, they can praise the person, they can create an environment where the person is encouraged just to share his or her account of what happened, without interruption, without judgment. The therapist can then validate that person's experience with supportive phrases. They can explore the worst aspects of the traumatic event from that person's eyes, and then begin to explore his or her thoughts and feelings at the time of the trauma, and then also of any subsequent changes that have occurred. And I think it's important that a therapist be attuned to any feelings of guilt or denial, blame, particularly self-blame, and also just general mistrust. And then from there, there are a few more areas that, in general, a therapist can explore with a person. In particular, their past coping attempts and how they generally cope with difficult situations. It's important to assess for substance abuse. Many people do turn to that at times to help cope with trauma. And then it's important to identify what are the person's strengths, what are their resources, and to look at it from truly a multi-systemic perspective that may involve extended family members or relatives, friends, schools, churches, any community organizations that the person may be involved in and where they can draw additional support from. And then it's, of course, important to always consider the person's cultural background and what influence that may have on the therapeutic process.
Thank you for that, Dr. Denigris. Before I go to the last question, there are three things I just want to really, I think, reinforce and emphasize from all you just said as much as anything. One is that if someone goes into counseling and therapy, that as crucial a variable as any is the nature of the relationship between the patient and the therapist. That the better that rapport, the more there is a deep connection, that by itself can be a very important variable. Second thing you mentioned I want to reinforce is to tap into a patient's strengths. We're not just focusing in treatment on what's wrong with you, what you've done bad. The strengths, the resources that you have can be extremely helpful coping mechanisms to tackle the condition and gradually gain some control, as David had alluded to. And the third thing you said that I'm so glad you said is the value of outside the office of a support system, family, friends, community, and so forth. So I just wanted to be able to reinforce that. So I have one more question for you, and this will do it. You were alluding indirectly to specific treatment modalities. If you could tell us some specific treatment modalities that you certainly recommend in the treatment of PTSD.
Sure. The research has shown that the first line of treatment for PTSD can either be therapy by itself or a combination of therapy and medication. And I'll just touch briefly upon the medication aspect. If a person decides to pursue that, it would be important that he or she see a psychiatrist. The medications are typically for symptom management. In particular, there could be anti-anxiety medications that are used sometimes more in the short term than in the long term. Then at times there's also antidepressants that can be prescribed. Both Zoloft are FDA approved for PTSD treatment. But generally, medications that belong to the SSRI class of drugs are recommended. And in addition to the medication piece, of course, the therapy is very essential. And that includes more or less about four different components. The first one would be what's known as psychoeducation, where the therapist provides education about the symptoms of PTSD, what the recommended treatment approach is. They can explain the rationale of the theory behind the treatment approach. And it's important during this time that they normalize the person's reaction, that this is a natural reaction to an abnormal event. So that way the person doesn't feel even worse that there's something wrong with them. But we want them to see that this is a natural reaction to something that is not natural, that is abnormal or unusual or atypical. And that seeking treatment is not a sign of weakness. As I mentioned earlier, many people think that they should be able to deal with the event and independently, and that's not always the case. So it's important that they feel empowered to be in treatment and to feel like they have some sense of control over the pace of treatment. That the therapist will work with them to guide the course of the therapy and the pace. So it can be empowering in that way too. Once they get into some of the specific interventions, a decent amount of time can be spent focusing on managing anxiety, learning coping strategies, going through relaxation training. Depending on the nature of the trauma, sometimes assertiveness training is important. And then we can focus more on some cognitive strategies. The approach that I'm describing basically falls in line with the cognitive behavioral methodology. So in terms of some cognitive strategies, really the gold standard has been cognitive restructuring. And that's identifying and challenging the person's thoughts about the situation. And being able to replace them with thoughts that are more balanced and giving them a more realistic, rational perspective on their current status right now. from there, from the moving on to the cognitive piece, typically treatment for PTSD also involves what's known as exposure therapy. And that can include two parts. The first part can be what's known as imaginal exposure, where the person and the therapist work together to disrupt his or her pre-existing or pre-established associations between the thoughts of the traumatic event and then the subsequent feelings of anxiety and distress. Once a person feels as if she or he has mastery over that, they can move into more in vivo exposure, which allows the person to confront the feared situation, which she or he may have been avoiding, in order to counteract the fear and then reappraise the threat that has developed since the trauma. Many times, the exposure therapy involves creating a fear and avoidance hierarchy, where the items on the lower end of that hierarchy are generally less anxiety-provoking, and the person feels better equipped to address those first, and then gradually move up the hierarchy to more challenging situations. And then, overall, during the exposure period, it's important that the person utilizes the previously learned strategies that I mentioned, whether it be the relaxation strategies, the anxiety management techniques, and then the cognitive restructuring. And then, generally, it's a very brief overview of the course of treatment of PTSD.
Thank you very much for summing those up, Dr. Denigris. I'm getting a signal. We have about 1 minute left. I would just like to add one other, generally I think it's described kind of an alternative approach to PTSD that is not necessarily cognitive behavioral oriented, which certainly is the standard approach, exposure treatment. Two real quick I just want to mention, generally under the heading of called energy approaches, one of which is abbreviated EMDR, eye movement desensitization and reprocessing, which is an approach that involves more focusing on the traumatic event in a nonverbal way, in which there is an attempt through, it's a little bit of an unusual approach. There's a use of oscillating movement, hand gestures, connected to recalling, to some degree like an exposure approach. But again, it's a bit alternative in that there's a more physical aspect to it. And then there's a variation on that called thought field therapy, which is oriented more to tapping, and it's a tapping of what's called meridian points. Some of you may be familiar with acupuncture. Certainly does not involve needles or anything of the sort, but it is sort of parallel, and it is another technique occasionally used under the heading of alternative approaches. So I'm going to wrap up. Dr. Denigris, thank you so much for being on the show. I very much appreciate it. I'm sure that my audience does too. Thank you.
My pleasure. Thank you.
Great. So I'm going to wrap it up. Again, I'm Dr. Sidney Cohen. I can be emailed in at the Radio Vision Network, www.radiovision.com. I also have my own website, which is www.sidneyjcohenphd.com. If you want to send something there, get more of an idea of my own work. And that's pretty much it. So thank you very much for tuning in, and this is heading in the right direction. And we're signing off.